really my great pleasure to introduce Professor Grace Wong from the Chinese University of Hong Kong. Grace, I'll turn it over to you.
Okay, thanks, John. Yeah, hello, everyone. So it's my great pleasure to give a short presentation to share with you the progress, the work of all the healthcare workers and also many other parties in Hong Kong try to eliminate hepatitis C. So some of my personal financial disclosure, which will not affect the content. To start with, I'd like to give you a big picture of the disease burden in Hong Kong. Hong Kong is a small city of 7.5 million population. The prevalence of Hep C in Hong Kong is not high, it's 0.3%. So that you may say the disease burden in Hong Kong is not particularly huge. 5 years ago, we have this multi-center study. We put together some real-world data and try to estimate how many patients we have yet to diagnose and treat. To cut the long story short, at that time point 5 years ago, we were not yet meeting the WHO goal because no matter the screening rate, diagnosis rate, treatment rate was quite fell behind. So I think that is a kind of good message, a warning sign for us. We should work harder. So we have been working harder. So in fact, on the same year, is that our government established this steering committee on prevention of control of viral hepatitis with many high officials and experts in Hong Kong. In fact, among those would be some key academic, like my two mentors, Professor Henry Chen and Professor Vincent Wong. They have been giving a lot of high-level advice and form some working groups, which the working group will also be responsible to organize some down-to-earth policies, like myself and Professor Vincent Wong would be the members of clinical working groups, in which that we would try to implement some action plans to provide service, staff training, importantly linkage to care of patients who have been diagnosed, and provide very cost-effective treatment. These are our road. So back 3 years ago, it was still the time that COVID just started not long ago. Our government still committed themselves to have this very first Hong Kong viral hepatitis action plan, which lasts for 5 years, to offer a lot of very important plans in 4 domains, like to raise the awareness, to provide regular survey of local indicator of disease, to provide prevention, and very important to treat patients. So these are the things that we have been doing. So one thing I would like to introduce is some partnership with our NGO. In fact, this program, New Life Liver, organized by our university as well as some NGOs, have been in place for more than 14 years. In fact, we have been working closely with our NGOs to provide public education. At the same time, we do the point of care testing to screen subjects at risk. We also have a lot of media exposure to educate our general population because, in fact, Hep C awareness in Hong Kong has been quite low over the years. And also, I would like to give my tribute to late Dr. Nancy Leung at the lower part of this slide. In fact, she was the founder of another important NGO, Asia Hep, which again give a lot of live screening, testing, media activities, which also would raise a lot of awareness. One of the things is this large-scale screening that we organize and diagnose a lot of undiagnosed subjects. So over the years, we work together with our NGOs, and one of the, I would say, quite successful program is this test to and treat program, which are recently in place because we now have the very good point of care H0 RNA. So everything can be done within just half a day. We invite our subjects at risk and do the screening tests. At the same time, we provide education, assessment, like transient elastography, and then after the result available in like 40 to 50 minutes, then we can start the treatment, DAA treatment right away. So in fact, with this program, in fact, we can really streamline all the steps and everything can be done within one morning that, in fact, our the patients feel very satisfied and also the treatment uptake rate will be very high. So I would say I close a very short summary of our program in Hong Kong. We have been working very closely with NGOs, and we find that the streamlined referral and care pathway can definitely increase the treatment uptake. So I think this is something that from our pilot program, we are now offering more information to our government. Hopefully this kind of point of care testing and also streamlined referral pathway can be in place, generalized for all citizens in Hong Kong. So with that, I thank you very much for your attention.
Oh, thank you very much. That was a very quick but thorough overview of your program. One quick question for follow-up. Many other programs really have a challenge of getting people on treatment after they receive a diagnosis based on a virologic test. You didn't show a care cascade, but could you give us a little bit of a sense of the success rate of getting people on treatment after diagnosis?
Okay, thank you, John. Yeah, I think if we refer to that half-day program that I just mentioned, in fact, the treatment uptake rate will be 100% because they are right there. So they are right on spot. They receive education assessment, and they would be very happy to receive the treatment because we explain to them clearly how the treatment will benefit them, the very, very high SVR rate and so on. But this only refer to this particular program. But if more general, for example, if we have to split the assessment into different visits, for example, we have conventional blood test first, and then another 2 to 3 weeks later, we ask them to come back to see the result and start treatment. With this conventional approach, we usually will lose around 10 to 15% of the subjects because they just lost the follow-up. They do not show up. So I think that conventional approach will, on every single step, we will lose some patients. So that's why if we have like 2-step, 3-step, then cumulatively we may lose 20 to 30% of our patients who have been diagnosed to have active viremias. So that's why I will really support this kind of streamlined half-a-day program, which can really do everything at the same time. So we'll minimize the loss to follow-up.
Right. Thank you very much.